In this video, we'll explore what happens to male body when abstaining from intimacy for an extended period. Does the body change? Is it bad for health? Men, have you ever wondered what happens to your body when you go too long without sexual intercourse? What changes can you observe in your body if you avoid physical intimacy for long periods? Does it affect your prostate health and overall sexual function? And are there benefits on prolonged sexual abstinence? Understanding sperm and semen. First, let's clarify the difference between sperm and semen. Spermatozoids are the male reproductive cells produced in the testes, while semen is the fluid that contains sperm along with other components, such as sugars and phosphates that maintain sperm viable alive until fertilization occurs. Sperm recycle process. As sperm cells age, they do not accumulate indefinitely. Instead, older sperm cells are broken down and reused by the body to produce new, healthier sperm. It's a natural recycling system, ensuring that only the fittest sperm are ready for potential fertilization. When men abstain from ejaculation, the sperm don't simply disappear. They may age, die, and get recycled within the epididymis, the storage site for spermatogenesis. So, if you're not actively engaging in sexual activity, the sperm are essentially looking for their next opportunity, continuously undergoing a process of renewal. What about semen itself? If you're abstaining, the seminal fluid production continues within the glands, such as the prostate, but without stimulation, it just remains stored, waiting for the right moment to be used. Anatomy and erection. Are there any changes? You may wonder if not having sex affects the penis size. Generally, there are no immediate changes unless you abstain for extended periods, such as decades, and if accompanied by significant weight gain. After years of abstinence, the principle of atrophy comes into play. Just like unused muscles can shrink, certain aspects of sexual function may diminish without regular use. Over time, a lack of sexual activity can impact erectile function. Initial responses might be quick, but after prolonged periods, you may experience difficulties in maintaining arousal, known informally as performance anxiety. It's temporary. Your body can easily regain its function with consistent stimulation. Impact on prostate health. Now, how about prostate health? Questions arise about whether prostate size increases or decreases during periods of inactivity, and whether there's a correlation with the risk of prostate cancer. A study involving 30,000 men provided insights into this topic. The findings suggested that those who ejaculated more frequently, over 21 times a month, had lower risks of developing both BPH and prostate cancer compared to those who ejaculated less frequently. This hints at a potential relationship between increased ejaculation and reduced risk of prostate issues. While we don't have a definitive answer yet, these findings suggest that regular ejaculation may be beneficial for prostate health. What happens to your sexual libido? Within the first year of abstaining, you might notice minimal changes in libido, perhaps an increase if you're used to regular sexual activity. However, if you're not, there shouldn't be a significant change. Over extended periods, typically several years of sexual inactivity, one's libido is likely to gradually decline. Testosterone is a key hormone in men's health, influencing libido, mood, muscle mass, and overall well-being. Abstaining from sexual intercourse can lead to variations in testosterone levels, although the effects can differ among individuals. Testosterone and sexual activity. General hormonal regulation. Testosterone levels are primarily regulated by the hypothalamic pituitary gonadal (HPG) axis. The hypothalamus releases gonadotropin-releasing hormone, GnRH, leading the pituitary gland to produce luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones stimulate the testes to produce testosterone. Sexual activity, including both internal and external stimuli, can influence testosterone levels. Studies suggest that sexual arousal can lead to short-term increases in testosterone. In prolonged abstinence, several years, there might be a gradual decrease in testosterone levels for some individuals. This can be linked to reduced sexual stimulation. Regular sexual activity promotes healthy testosterone production. Lack of stimulation intervenes in a feedback mechanism that lowers the levels of GnRH, subsequently reducing LH and testosterone secretion. Psychological factors. Emotional states like depression or anxiety, which may occur with prolonged abstinence, can also affect testosterone levels, typically leading to lower production. Not having sexual activity can lead to feelings of loneliness or isolation. Hormones like oxytocin, known as the love hormone, and dopamine, related to the brain's reward system, play key roles in pleasure and connections with partners. Absence of these experiences can induce feelings of lethargy or sadness. While abstaining can serve as a period to reflect, it can also create emotional distance unless supplemented with other forms of connection. Prolonged abstinence, sexually transmitted infections, STIs, and urinary tract infections, UTIs. STIs are a concern for both men and women, and their transmission rates are inherently linked to sexual activity, and so the frequency of sexual activities and the partner's sexual health play a significant role in the prevalence of these infections. When sexual activities decrease, the transmission of STIs diminishes accordingly. However, the situation is different when it comes to urinary tract infections. For women, the anatomical structure of the urinary tract makes them more susceptible to UTIs, which can continue to occur regardless of sexual activity. In men, UTIs tend to be less frequent overall, primarily because they are often linked to sexual activity. This highlights the interesting fact that UTIs can, indeed, be transmitted sexually in men. What are the benefits on choosing sexual abstinence? Men who practice sexual abstinence can be categorized into various groups based on their motivations, beliefs, and contexts. Here are some of the key groups and their claims regarding the effects of abstinence on mental, emotional, and physical levels. Religious or spiritual practitioners. Many religions advocate for sexual abstinence for spiritual reasons, morality, or discipline, e.g., Catholics, Buddhists, etc. Practitioners report enhanced focus, clarity of mind, and improved spiritual connection, a feeling of peace and fulfillment from adhering to their beliefs. Some claim enhanced physical energy and vitality. The discipline involved in abstaining can also promote healthier lifestyle choices. Health and wellness advocates. Some men pursue abstinence to improve general health, mental clarity, or as part of a detox regimen. They may experience improved concentration and cognitive function, linked to reduced distractions from sexual thoughts or activities. Increased emotional stability, since a period of abstinence allows for introspection and personal growth. Certain men believe abstaining can lead to increased energy levels and better physical performance, especially in athletes. Men recovering from addiction or compulsive behaviors. Individuals recovering from sexual addiction, compulsive behaviors, or other forms of addiction, e.g., pornography. Achieving abstinence can contribute to a sense of control over one's impulses, Emotional regulation improves as men learn healthier coping mechanisms and enhance their self-esteem, which translates into better physical health and fitness. Men focusing on self-improvement or personal development. Motivation. Individuals may choose abstinence as a way to redirect their energy towards personal goals, professional development, creativity, or even celibacy. They claim to experience sharper mental acuity, better decision-making, and creativity because abstaining helps them channel their sexual energy into productive endeavors with a sense of empowerment and achievement from self-discipline. Abstinence can coincide with healthier lifestyle choices, such as consistent exercise and better nutrition. They may report less emotional drama associated with romantic relationships, leading to greater emotional stability. Conclusion. In prolonged sexual abstinence, anatomical changes don't happen unless you gain a lot of weight, and functional performance issues, if any, can be overtaken by managing anxiety issues. There is a decrease in both STIs and UTIs. There is improvement in general health, more mental clarity, higher energy levels, and better performance in daily activities. While short-term abstinence may not significantly affect testosterone levels, prolonged sexual inactivity may contribute to reduced testosterone production due to a combination of hormonal feedback mechanisms and psychological influences. Overall, the effects of sexual abstinence vary depending on the individual and the context. While many men report positive outcomes, others might experience challenges, such as increased frustration or feelings of isolation. It's important to remember that every individual's emotional experience with abstinence is unique and influenced by personal circumstances, beliefs, and psychological resilience. Thank you for watching, and subscribe for more insights.